So we place it in the mid thigh, and then we look for our anatomical landmarks. All right. So that's all you just expose, and you take the mid thigh level, and then you look at the ultrasound. So on the ultrasound, I've placed it in the mid thigh. Okay, and I can see a vessel. So this is the superficial femoral artery. Okay, there is also a profunda femoral artery, which is not here, it's very deep. Okay, so our job is to see the superficial femoral artery. Okay, this side is medial. All right, this side is medial. This muscle is your adductor longus. It is medial. All right, it is an adductor. Adductor means it's pulling towards the groin, so it will be on the medial side. The muscle on top, this very, very bright muscle, this is your sartorius muscle. All right, this is sartorius muscle. And on this side, the muscle on the lateral side is your vastus lateralis, right? Or it's a vastus medialis, so not a vastus lateralis. The vastus medialis is on the lateral side because the quadriceps are far more lateral, okay? So the point where we want to do this is where the sartorius muscle is on top of the artery. So that will be the true adductor canal, right? The sartorius muscle is on top of the artery, and on the lateral side, we'll have the vastus medialis, and on the medial side, we're going to have the adductor longus muscle, okay? So now where will so here we are targeting two nerves. I can actually see the nerve in this case. So again, it's quite rare to see the nerve. Let me see if I can show you. Okay, so I've frozen the screen. This little cherry here is the Sephanous nerve, okay? So we're gonna come from that side, from the lateral side, okay? We're gonna come from the lateral side through the quadriceps, and we'll come medially. And what you need to do is you need to give the drug just lateral to the artery, okay? So this is the lateral side actually, because the quadriceps is there. So the quads muscle will come like this, and you can just give the drug here around the artery, and you will find the Sephanous nerve. There are actually two nerves that we are blocking in this case, but I'll not go into too much of the details because we can't see the anatomy very clearly. There are two very important nerves. One is the Sephanous nerve, and one is the nerve to the vastus medialis. There are two targets of the adductor canal block, not one. And there's a very big difference in analgesia between the two if you are missing out your nerve to the vastus medialis, all right? So that's it for the Sephanous. Unfortunately, I wish I could show you the whole anatomy, but we can't undress him. So this will have to do. So sartorius above, the vastus medialis on the lateral side, and adductor longus on the medial side. You will come in plane from lateral to medial and give it near the artery. So in this case, we can actually see the Sephanous nerve. Usually you may not be able to see it, and that's okay. All right. So that's it.